was gonna, can I suggest?
Or just click on here.
Never mind.
Slide. Whichever. This is so weird. Oh, but maybe if I turn this thing off.
Okay. Well, welcome everybody. We are a little bit ahead of schedule today, which I think is always nice. It's my pleasure to introduce our next speaker, Poppy Fodrell, and she is going to be accompanied by Kathy Walker. Well, Poppy started her career in human services in 2003 at Prince William County Department of Social Services as an eligibility worker. And then after about 3 years, she moved to Warrenton and she worked at Fauquier Department of Social Services. And at that time, her primary caseload involved assisting adults with benefits. So she's got a really good grasp on that knowledge of benefits to help people. That can be very confusing for people knowing what they're eligible for. And then it was there that Poppy was introduced to long-term care, Medicaid and Medicare, which, oh my goodness gracious, can be so confusing, as I think most of us appreciate. Her work experience, through her work, she's really helped so many older adults, especially those who are economically and physically challenged, and she's helped them work through the complexities of the insurance process. She has been with she was with Fauquier County DSS for 5 years ultimately, and then she was offered the position of senior advocate at Rappahannock-Rapidan Community Services, which is our local area agency on aging. And as part of her duties, she trained for and became the coordinator for the regional VICAP program. That's the Virginia Insurance Counseling and Assistance Program. Poppy will be accompanied today by Kathy Walker. And Kathy Walker is...
Hello.
Hey, Kathy. I never remember your exact title because I think it's 2 different things at least.
Yep. Aging support coordinator and the long-term care ombudsman.
Awesome. Thank you for that. And Kathy, I know Kathy has been in the aging field for quite a long time. She has extensive experience and background in helping older adults to navigate the system as well. She is also with the Rappahannock-Rapidan Community Services. They are very close partners of aging together. We work very closely together. We appreciate all that they do, and I certainly personally appreciate Poppy and Kathy. And I will go ahead and turn it over to you.
Okay, thank you. We'll get started now with Poppy. All righty. Well, thank you so much. And I really appreciate and I just admire Ellen so much. She has taken this thing by the horns and she's doing such a great job. I'd do anything in the world Ellen Phipps asked me to do. So I am really, really grateful and thankful to be here. And I'm happy to hopefully present some information that might help you understand the differences between Medicare and Medicaid. And but if not, we'll have our contact information. Ellen has our slides, and so you can always reach out to us at any time for any help that we might be able to give you. So I'm here to talk about Medicare and Medicaid and the differences. As Ellen said, I work for Rappahannock-Rapidan Community Services, which is also the area agency on aging for our planning district, Fauquier, Madison, Orange, Rappahannock, and Culpeper. And through the Area Agency on Aging, the federal government provides all of the area agencies on aging throughout the whole country money for Medicare assistance for folks that are receiving Medicare benefits. And it's in the Virginia, it's called VICAP, Virginia Insurance Counseling and Assistance Program. And it's administered through DARS, the Department of Aging and Rehabilitative Services, and from a grant with the Administration for Community Living. So all that bundled together allows us to provide some free and unbiased Medicare counseling to anybody on Medicare that calls us. So what exactly is the difference between Medicare and Medicaid? I don't know who thought it was a good idea to make these 2 things sound so similar. And while they both provide medical benefits, they're offered in 2 totally different ways. So the difference is, so Medicare is going to be, and they both have well, in the state of Virginia, they're blue and white, and Medicare is red, white, and blue. But Medicare is for people that are 65 and over. It's the health insurance for Medicare for people 65 and over, people who have been disabled by Social Security and paid into the Social Security system for Medicare benefits for their 40 quarters. And for some people, like with Lou Gehrig's disease and other disabling conditions. Medicaid is specific to people with anybody in the whole state of Virginia can apply for Medicaid now with the expansion, but is really based on income and resources to see if you qualify. So for Medicare, there's different parts of Medicare. When you get your card, everybody knows about the A and the B. So that Part A benefits are specific to your hospital, inpatient hospital stay. You've been admitted to the hospital, your Part A benefits are going to cover that. If you're going to need skilled nursing facility afterwards, your Part A benefits are going to also cover that. They're also going to cover some hospice and some home care possibly. Part B is going to be everything else under your medical services. It's going to be doctor's visits, lab work. It's going to be durable medical equipment. It'll be any labs you do, any outpatient services, the emergency room, all those are covered under Part B. Part C is the Advantage plan. It's not going to be on your red, white, and blue A and B card. Part C is completely separate, and it's an option for you to take, and it's the Advantage plan that replaces your Medicare benefits with a different insurance company. And we'll talk about all that later. Part D is going to be specific to your drug plan, and it's going to cover your drugs, specifically only drugs. So the costs for Part A. Part A generally is premium free. So you're not going to have a cost for your premium as long as you've paid your 40 quarters into Social Security by working 10 years. You get premium free Part A benefits, but it does have the highest deductible. The deductible to be an inpatient in a hospital is $1,484, and that's not per year, that is per benefit period. So you could be admitted to the hospital, and then if you're let's say you're admitted, you pay your deductible, and you're not readmitted within the next 60 days, but you're readmitted, let's say day 63 after you've been discharged. You're going to pay that inpatient deductible all over again. So it's really high. And then there's also co-pays for additional stays in the hospital. And then after a certain period, Medicare is not going to pay anything at all, and you'll be responsible for the entire payment. Now, when you're in the hospital, if you've been admitted to the hospital for at least 3 days, and you have to, now, unfortunately, you have to ask, because a lot more people are being not admitted, but they're in the hospital, they spend the night in the hospital, and they think they're admitted when they're really under outpatient services. And the hospitals are supposed to provide you with a paper that says Moon, and it's about being paid or billed in an observation sort of setting versus admitted to the hospital. And it really makes a difference, especially with your Medicare benefits. But so what I would say is, if you go to the hospital under Medicare and you spend the night and nobody's giving you a paper, ask them what your status is. Are you an inpatient? Are you outpatient? Because it'll matter if you need skilled nursing afterwards. If you are admitted to a hospital for 3 days under Medicare and you need skilled nursing, they'll pay for the next 20 days for free in skilled nursing for you. But if you don't have that 3-day admittance, it was under the pandemic that it was sort of waived, but we're not exactly sure if it's waived still or not. So it's always good to ask. You want to know going into this, because it can be pricey either way. So it's good to ask, but after those 3 days, if you're admitted, Medicare will pay the first 20 for 100%. And if you need more rehab after that, they'll still pay part of it. You'll have a copay for days 21 through 100. And after 100 days, it's basically long-term care at that point in their mind, and it's going to be all your responsibility. For Part B, that's the one where you're going to pay a premium. And the premium this year is $148.50. So that premium, if you're receiving Social Security benefits, is going to become deducted automatically from your Social Security benefits. If you don't get Social Security, but you still apply for your Medicare, they're going to send you a bill. It'll be a quarterly bill. And there are ways now that you can pay it monthly if you so choose. But you will have a premium. You will have to pay it, unfortunately. And it also has a deductible, but this one is much lower. The annual deductible for the entire year is $203. So the way Medicare works, if you go to the doctor and you incur services, you're going to be billed 100% of the first $203. After you have that, and you've paid that and satisfied that, Medicare is going to pay 80% of all Medicare approved charges, and then you're going to be billed the 20% after that. There are some things that are not covered by Medicare: long-term care services, dental care, vision care, unless they're medically necessary. And a lot of this is determined by how your doctor codes things on your bills. Glasses and contacts are generally not covered at all unless you have cataract surgery. And then after that, Medicare will help you. It won't pay for cosmetic surgery, acupuncture, or hearing aids, or any exams for fittings. So enrollment is it's probably very confusing. It's extremely confusing, actually, because they keep changing it. So right now, as of we sit right now today, October 13th, 2021, if you are 65 and you're already receiving your Social Security benefits, or you have been receiving your Social Security benefits for at least 24 consecutive months, you're going to automatically be enrolled in Medicare, and you're going to get a Medicare card. Those are the only people that are going to receive their Medicare card automatically, is if you're already receiving Social Security benefits. And you have an initial enrollment period when you are 65 and you've already got those benefits. You have 3 months before, 3 months after, and the month that you are 65 to enroll in your benefits, enroll in your Part B, your Part D, if you want an Advantage plan, those sorts of things. If you're not receiving Social Security benefits at 65, you have to apply if you want them. If you're still working, or if your spouse is working and you have group health coverage, and it has to actually be group health coverage through your employer. It can't be COBRA. It can't be a private company. As long as it's group health coverage, you can delay most chances your Medicare benefits until you are retiring. Because so many people used to be, everybody automatically was enrolled in Medicare. And then Medicare realized more people are working longer. And so they started mailing back their benefits. They didn't want their Part B. So I think that's why they've changed it, that you have to apply if you're not getting your Social Security. You can get Medicare without Social Security. They're just going to bill you, and you're going to have to pay your Part B premium on your own. And they do allow you the special enrollment period. And it really, honestly, if you're working or your spouse is working and you have group health coverage, you sort of get to pick when you want your Medicare to start. You can, and it's not a difficult process. The most difficult part is sometimes reaching Social Security, but they have made it easier to apply online. You can fax things in, things like that. But if you miss your initial enrollment period and your special enrollment period, there is also the general enrollment period every year, January 1st through March 31st, that you can apply. And I would suggest anybody that misses those periods, please apply, because if you don't, you're going to have a late enrollment penalty for your Part B benefits that will last for the rest of your life. And it's like a 10% fee of what the $148.50 or whatever it is that year. So it's just important to know when you need to apply. And you can always call us. Always call us. We can help you. Everybody's sort of individualized. So if you have questions, you can call us anytime. This little chart is just another little confirmation about the enrollment periods. And to throw another little curveball, there's also another open enrollment period for Medicare Advantage plans. We have an annual election period for the drug plans and the Advantage plans, but then they give folks with Advantage plans another sort of window to change those plans or drop them and go back to original Medicare. So the Advantage plans, I am sure every one of you has seen all the ads on TV for the past several years about all these plans, and you need to get your Medicare checkup, and you could be eligible for all these benefits. And while all those things are very true, those calls are going to lead you to an insurance salesperson that's going to tell you about the Advantage plans. So it's really important to have your knowledge before you call them, because they're going to make them sound really great and sound too good to be true. And sometimes they are. And I've had people call that I have met with, and unfortunately they've enrolled in these benefits only to lose their retiree coverage or to lose their supplemental coverage, not understanding that you cannot have an Advantage plan and all these other things. So it's so important to know. And these Advantage plans, while they do sometimes offer additional benefits, the old adage is very true. You get what you pay for. You really do. So the Advantage plans, while they're good for some people, they are going to cover your, they're going to replace your Medicare A and your B. So you have to have A and B. They're going to replace your A and B benefits with an insurance company that you have to be in their network. And while they have to go by all of Medicare rules, they also have their own rules, their own charges. You may end up paying more for some things. They might charge you, make you go out of network for things because you have to utilize the network that the plan is working within. So if the provider does not work within that plan, you're going to pay 100% of the coverage in order to see them if you want to. So it's really important to know what your providers accept. And you can't just ask them if they accept Medicare if you have an Advantage plan, because the Advantage plan is what it's gonna go by. So it's just really important to know there are copays and deductibles, and they are all different. So that's something that we can always help you look at when you call during open enrollment or anytime during the year. The amount of Advantage plans have gone up tremendously. We have like 23, I think, in Fauquier County this year. It's so many. And all of ours have at least added 3. All of our 5 counties have at least added 3 new Advantage plans. So CMS is really pushing this, but it's really based on what is best for you and your health, your health situation. Then you have the drug plan. Now, the drug plan is something that Medicare requires everyone to have, whether you take a medicine or not. Thankfully, there are lots of plans available. This year, there's 23, used to be 30, but there's 23 plans available, and the cheapest one is like $7.10. So if you don't take any meds, most people that I meet with, if they elect to get a drug plan, they're going to take the cheapest one because they don't have any medicines to definitely cover. But basically, the drug plan is going to help you cover the cost of your drugs. They're managed also by Medicare approved companies, insurance companies, and they have to really go by what Medicare tells them to. If not, they're going to be sanctioned, and then they won't be able to sell their plans through the Medicare Plan Finder. And I've seen lots of plans sanctioned because they go up in price during the middle of the year when they're not allowed, or whatever. So they have to really adhere to what Medicare allows. And it is so important that people understand when you get your Medicare, your A and your B, if you don't have TRICARE, or if you're not a veteran, you have to get a drug plan unless you want to be penalized when you finally do enroll, because there will be a late enrollment penalty. Not all of the plans cover the same meds, so it's really good to check and see which is the best plan for you. And the plans do change annually, so it's important to have your stuff looked at every year during open enrollment, either by us for free or through the plan finder on medicare.gov. It's really pretty customer friendly, but we're always here to help you if you need help. So once you get your A and your B card, you're going to have your A and your B, and then you're going to have to decide which of these options you want. You can keep your original Medicare, your A and your B. If you have Medicare A and B, the only thing you have to ask your doctors is if they accept Medicare assignment. You can go anywhere in the continental United States to see any provider that accepts Medicare assignment. And through that, you can pick up your standalone drug plan, and if you want a supplement or a Medigap plan. Otherwise, you can go with Advantage plan. So that's going to, again, you have your A and your B benefits. You can buy into a Medicare Advantage plan, which is then going to replace those A and B benefits with that insurance card or that insurance network. And then it's important, if you need the drug coverage, if you need to satisfy that requirement, that most of the plans have the drug plans, but they don't all have them. So it's always good to make sure that Advantage plan, if you need it, covers the drug part. So the supplement, Medigap, Medicare Supplement plans, they act like they say as a gap. It fills the gaps of your Medicare benefits. So like we said before, Medicare, once you pay your deductible, it's going to cover 80% of your services. So then there's the 20% co-insurance or the deductibles that you're going to want covered. And so in the state of Virginia, the options are available here. There's different plans available. And they also use letters A through N. So these are not the same A and the B that you have on your card. This is buying into different benefits to cover, say, the Medicare Part A co-insurance or the deductibles. If you didn't have your Medicare benefits prior to January 1st, 2020, you are no longer eligible to buy into a Plan C or a Plan F, which are the most comprehensive. F was the most comprehensive. It covered every single thing, including the Part B deductible. But now all the companies, all the plans available, none of the new plans are going to cover the Part B deductible. But looking at this chart, the G plan is the most comprehensive. It's going to cover everything except that. So once you pay the 203, which of course it's going to go up like everything else. So once you pay that deductible, then your G plan is going to pay everything else. So you go to the doctors that accept original Medicare, you're going to give them your Medicare card, you're going to give them the supplemental card. Does not matter if the provider works with that supplemental insurance, because 9 chances out of 10, Medicare is going to bill them for you. So they don't need to be in their network. As long as they accept original Medicare, it's all you have to worry about. If they're going to bill Medicare, Medicare is going to bill the supplement, and knowing which plan you have, you'll know how much you have to pay outside of that deductible. And again, we're always available to help you, show you the options. We have the charts, we have the prices, and we're available to help at any time. And Medicare open enrollment, it's starting this Friday. And let me tell you, it is our busiest time of year. Yes, it's our busiest time of year. And so October 15th through December 7th, every year is when if you have an Advantage plan or your drug plan, those are the two things that that you can change. If you have a supplemental plan, and I didn't go over this before, if you have a supplemental plan, the way they work, you have your A and your B benefits. When you first turn 65 and you are enrolled in your Part B Medicare, you have a 6-month window to buy a supplemental plan that they cannot ask you any medical underwriting, no medical questions. They have to enroll you. They have to cover you at the same rate for everybody else. But outside of that 6-month window, it's really difficult to get another guaranteed issue window. So you'll have to go through medical underwriting at any time during the year if you ever want to shop and change those plans, which you can, but you're going to go through medical underwriting every time. So open enrollment, when you see it on TV in the state of Virginia, it is specific only to the drug plans and the Advantage plans. And I have heard this year, even one of the drug plans, the Part D plans, has gone up from like $23 to $60-something for the premium. I'm not even changing the plan, like who they cover. So most people enrolled, well, all people enrolled in these plans are supposed to get an annual notice of changes. And if you don't pay attention to it, if you don't get it, if you don't read your mail, in the coming January, you'll have this new premium and you're like, oh my gosh, I can't afford this. But you didn't have, you didn't look. So we always want to make sure everybody looks at their options from October to December 7th. After your changes are made, they will take effect January 1st. And then, it's just much better. Last year, we saved people a lot, like over $170,000 changing their plans. And that was during the pandemic when we really couldn't even see anybody in person. So the years prior to that, people can save so much money just by changing their drug plan. Their premium might be too high, or they're paying for a plan that doesn't cover some of their really expensive meds, or they don't understand that they qualify for extra help. All those things we can help you to discover when you come in and see us or call us. And then there is some help available. So through Social Security, you can apply for extra help. And what extra help is, it's based on income and resources if you're married, if you're single. But what it can do if you apply, it can make your Part B, your Part D drug plan premium lower. Sometimes it could make it zero. It will change the price of your medicines to zero to maybe $3.60 or under $10. So it's really important to see if you qualify, because some of these plans, some of the drugs these days are like over $300 or $400 a month. And if you can qualify for a lower premium or copayment, it's always good to find out, because saving money is really important, especially everything is so much more expensive these days. So if you ever want to be screened or need anybody that needs to, you tell them to call us. We can also help them apply right online through Social Security. And then there's also the Medicare Savings Program, and that is governed through Medicaid. Medicaid processes these applications, but what they do is they help folks that are enrolled in Medicare to either, like QMB, you'll see on here, the qualified Medicare beneficiary. It's almost like your Medicaid is your supplement to your Medicare benefits. So you have Medicare, your income is within those limits and your resources. Medicaid then becomes your supplement. So you go to the doctor, Medicaid, the QMB would cover the co-payment, co-insurances, and deductibles that you would normally have to pay. Plus, it's going to offer that Part B premium back into your Social Security check because Medicaid will cover that for you completely. The other two, the SLMB and the QI1 plans, only cover that Part B premium, but still, that's still $148 back into your check to help you, for the rest of the month. So it's really important to know if you qualify. We can help you understand the differences, help you know how to apply. And Kathy actually is going to talk about applying for Medicaid in the very next slide, I believe. So we're going to move on to Kathy.
I'm going to try and fix this screen.
What do you mean?
It's still-
That's only for us.
Okay, so the next part is Medicaid. And Medicaid is additional aid. This is a federal program administered by states. So you have to follow state rules as well as the federal rules. And Medicaid is income-based as well as resource-based for certain covered groups. For the age, blind, and disabled program, resources are counted. And for other groups, resources are not counted. One of the most widely used Medicaid benefit is for long-term care. And with long-term care Medicaid, there are two different ways to use this benefit. Community-based care, which is care you can receive at home. You have assistance through agency support for aides or nurses as needed, or the consumer directed, which is a program where you would sign up with a facilitator and they help to hire your aides and process payroll. The community-based care does not provide 24-hour care at home. That is typically only done at a nursing home. And your nursing home benefits are the only area where Medicaid will pay for long-term care. They will not pay at an assisted living. Applying for Medicaid is there are several different ways you can apply for your Medicaid benefits. You can apply online through Common Help, and that website is commonhelp.virginia.gov. You can apply through the marketplace. You can use a paper application and drop that off at your local Department of Social Services. They even have a call center. So they're trying to make it easy and accessible to apply for Medicaid benefits. And all of the Medicaid applications are processed through your local Department of Social Services. In the state of Virginia, there are 6 managed care companies that provide Medicaid benefits. And this is a list of those 6. Aetna, Molina, United Healthcare, Anthem, Optima Health, and Virginia Premier. With those companies, you would also receive services through a care coordinator, and that's an individual assigned to you to help navigate the system and help coordinate your care. We'll also talk a little about the Virginia Senior Medicare Patrol Program. And again, this is another federal program administered by the state. And this is a protection program for your healthcare needs and your personal information. So you always want to protect your Medicare card so that no one else has access to it. And over the years, Medicare has changed the number, so it no longer has your Social Security number and has just a random number on that, but it still has your some personal information. Through SMP, you want to participate by detecting fraud, errors, and abuse by reading your Medicare summary notice. And that is a statement that you'll receive through Medicare when services have been delivered, or your explanation of benefits if you have a Medicare Advantage plan. And then, of course, you want to report any problems that you see on your benefit notices by first calling your healthcare provider. And if they're not resolved, at that point, you can call the SMP hotline. And this is a sample of your Medicare summary notice. It will show the service provided and the date and the provider. If there are denials, it would be listed. And you always want to make sure that you're billed for services received and not something that you did not receive at the doctor's office or hospital. On this slide are a list of the aging services that are available through Rappahannock-Rapidan Community Services in the 5 counties that we serve. The Long-Term Care Ombudsman Program is an advocacy program for individuals receiving long-term care at home or at a facility. We operate senior centers in each of the 5 counties. The senior centers are open to individuals 60 years of age or older, and a lunch is provided daily. They're open 4 days a week. We also have a home delivered meals program where frozen meals are available. They're delivered to persons 60 years of age and older who are homebound and have no one in the home to help prepare meals for them. At this time, there's also a temporary meals program available where people can come and pick up a box of frozen meals, and you'll want to give us a call and get details for that. We talked also about the Virginia Insurance Counseling and Assistance Program, which is the VICAP. There are 5 counselors available at our office that can help you navigate your Medicare and long-term care benefits through Medicare and Medicaid. A senior cool care program that's available in the spring and summer, where it's a partnership between the state of Virginia and Dominion Energy, providing fans and air conditioners to eligible seniors. And the other service we provide is the Foothills Area Mobility System, otherwise known as the FAMS call center, for transportation in the 5 counties. Information for VICAP and other services provided by Rappahannock-Rapidan Community Services in the Aging Services Division. Contact information is available. We have someone in each county that serves that county for aging services, and this is a list of phone numbers, names, and extensions. And we're available to take questions.
That is great information. Again, just so much information to take in. Yeah, we'll open it up for questions. So please go ahead, either type your information into the chat or raise your hand by going down to the bottom of your screen and clicking on the little hand down there to virtually raise your hand. And I think Steve can see if someone's hand is raised. I'm not sure if I can see that or not.
Yeah, no, I'll take care of that. And Poppy, I may have missed it, but this is definitely a timely presentation, because doesn't open season, doesn't that open tomorrow?
Friday. Oh yes, Friday.
Okay.
Yes, and the slides are available. I sent them to Ellen so she can disseminate them for sure. Is that how you wanted to do that, Ellen?
Yeah.
I didn't even ask. I'm sorry.
Yeah, no, the slides are available. They're already up on the website. I think Caroline's on top of it, and I think they're
Yes, she
already up
is.
there on
Great.
on the website on
They
our
are.
webpage. Yeah, thank you. Yeah, we do have a few questions coming in here. Let's see if I can. Oh, yeah. So that was the slides. Okay. Okay, so there's a lot of information that this person, Steve, he's just starting to process this for his dad. would like to come and meet with somebody after they get after he gets information from his mom. So they should just contact you.
Yes, I would say just call us and you call the main, if you call the main number, they're gonna ask you what county you live in, but on that one slide, it shows who works for each county and who to call. So it depends on whichever county they live in. Absolutely. Call us directly.
Okay, and I guess kind of along those lines, how would people find these services in other counties in Virginia?
You have to call me. I have the list.
Perfect. Just
And they
call
can also
Poppy.
look up the area agency on aging in the county that they live in.
Yes, what Kathy said.
Perfect, perfect. Ursula says, apologize if I missed something. However, is it necessary to have Medicare and Medicaid? And if so, when and how is that determined?
It is determined, so Medicare, Medicare is for people 65 and over. If you paid into Social Security, then you're gonna get your Medicare benefits. Medicaid is once you have Medicare, if your income and resources will allow you to get enrolled into the other Medicaid part, which you have to also apply for. So if you need additional services, if you need long-term care benefits, if you need help paying for your premiums, those are the Medicaid things that would come along with the Medicare. So it's not necessary. I mean, it's not everybody is in both, but if your income and resources determine it, then you could be in both. I hope that answers the question. If not, you can always reach out to me.
Okay,
Directly.
thank you. Thank you. Ursula, hope that answers it, but reach out to Poppy, please, if you need further, if you'd like some further explanation on that. Steve says, I know she has questions, but I don't know specifically, does Medicare or Tricare cover any in-home assistance?
Medicare does not. Tricare, if the person is a service-connected veteran, it's possible they could be eligible for veteran benefits through the VA or through those sorts of things. I don't know if Tricare offers in-home care, but through the VA, I think so. Depends.
Probably just through the VA.
Yeah.
And if it's Tricare, they're better off calling the Office of Personnel Management to see if they have that benefit for long-term care at home.
Good. Okay, thank you. Hope that answered your question there, Steve. Carol says, thank you for your guidance for other counties. Okay, thank you. Very helpful. Yes, it's confusing. The two names are too close in name. Oh my goodness gracious, I know. Medicare, Medicaid, it's like, wow.
Yeah.
It's so confusing. Call your area agency on aging anywhere, yeah, or call Poppy if you need the list there. Okay. Yes, the slides are up. Okay, let's see. I'm just scrolling through here. What's the best way to shop for insulin coverage when not eligible for help? Great question.
So I'm assuming you mean through the Medicare Part D. I would say on the Medicare Plan Finder, so there are some plans that offer insulin savings. They don't all offer insulin savings. However, what I would suggest doing and what I have found is if you go to the Plan Finder or you call us, you go to the Plan Finder, you list all of your meds, it's going to bring up the cheapest plan for you across the board. So if you're taking insulin, but you also have all these other medicines, the insulin savings plans might not be the best ones for you. So it really depends, but there are insulin savings plans that you can specifically, if you're on the Medicare Plan Finder, you can request information on just those insulin savings plans, but then it might not cover all of them. So it's best to put in all of your meds. You can also go to needymeds.com, and they also have all the assistance plans through any pharmaceutical company that offers assistance or offers coupons or whatever. You can go to Needy Meds or go to GoodRx. GoodRx will give you the best plan prices for anybody that doesn't want to use their Medicare benefits. Can you think of anything else? Yeah, insulin it's terrible, but it's always good to search both ways, because what I have encountered is, yes, there are insulin savings plans, but a lot of times it doesn't cover the other meds people are taking. So your plan is going to be really high either way. Like it won't cover, like, let's say a blood pressure medicine or something, but it'll help with insulin. So, and some of the pharmacies don't always participate. So if you need help after you're looking through the plan finder, please always call us and we can hopefully help direct you in the right place. It's getting better, but it's not great for insulin folks, COPD folks, people that need breathing treatments.
Yeah.
The donut hole is a real thing and it's
Yeah.
horrible.
Yeah, I thank you for that. I know, related to that, I actually wonder. I know sometimes, for example, my husband gets a very expensive, injection every month, and we're not quite there yet for Medicare. But what we found was the drug company had a program.
Yep.
And it has been phenomenal. I mean,
Yes.
this injection, I'm talking thousands of dollars every
Yep.
month. And
My stepfather too is on the
Yeah.
same sort of thing. And I
Yeah.
encouraged it was hard they applied for the help because I'm like, it's based on your income. They're not going
Yeah.
to look at it. They just need to know how much money you make. They're not going
Right.
to take your money. They just want to know
Right.
the money. And thankfully, because he wasn't going to do it. And I'm like, what are you not going to do it? Because anyway, so
Yeah.
they applied,
Yeah.
they get it shipped right to them through the company. So yeah,
Yeah.
you're very right, Ellen. The pharmaceutical companies are the best way to go.
Sometimes they have a plan.
The income limits are high. They're
Yeah.
really
Yeah,
high.
they're high. And then my question there, though, actually, Poppy, is would you still be eligible for those plans if you're on Medicare?
Yes,
Like, does the drug
definitely.
company, they would
Yes.
still help even if you're on
100%.
Medicare?
Yep,
Great. Okay,
for
good
sure.
to know.
Yes.
Okay.
Yes. Yep.
Ginny has
Uh-oh.
listed
Whoopsie.
the number 540-825-3100 for an appointment in your county. Poppy's extension is 3427 in Fauquier County. Whoops,
that's
wrong
right.
extension. Oh,
That's right.
that's
3427.
right.
Yep.
3427.
Okay. Oh,
Right? Okay.
okay.
All right. We have a question. Okay, do you have any understanding or explanation why Kaiser is available to us here in Fauquier County, not Kaiser Medicare? My mom and I have the same doctor in Haymarket, yet if she was to move into my house, she would lose her Kaiser.
Yeah.
Any thoughts on that one, Poppy?
Oh yeah, definitely. It's because when they develop these Advantage plans, they develop them based on the zip code where you live. So it prevents you from being eligible. Fauquier is in a really crazy place because people in Prince William or Loudoun County, if they move across state lines, they lose their Kaiser benefits, even if they are willing to drive over there, because Medicare has regulated it that it's based on the zip code where you live. It makes no sense, but that is absolutely true. And she would lose it if she would. And I've seen it happen a whole lot, and it makes no sense to me, but that's how Medicare regulated it. I don't know why.
Wow.
I wish I knew why. I wish I knew somebody I could complain to, because I've seen it happen a whole lot. And if you've developed this relationship with this doctor, with this practice, and then all of a sudden you move and you can no longer see them, but you have no problem getting there. Yep.
Wow.
It's the truth.
Wow.
I wish I knew why.
Yeah, thank you for that. You are clearly a plethora of information, like a walking encyclopedia.
Well, the five of us had to learn. I mean, because the calls, and this is something we do all year round, and we can help with appeals. And I think just through our own knowledge and experience doing this, we have all learned so very much about this program. I mean, people call me the Medicare expert, but the five of us have become experts in this because we have to be. We got to know, so we know.
Yeah.
And if we don't know, we're going to hopefully find out.
Yeah, and I think it's constantly changing. So
Yes.
even for the consumers, if they think they know, you
know.
still want to make sure, just in case something has changed.
I do wish that, I love the VICAP program. I think it is a really needed program. I wish it was a required thing that people that got Medicare had to talk to somebody, because if they ask Social Security, they don't know. And thank God, a lot of times they won't tell them anything, but sometimes they'll tell them the wrong thing. Or you're going to then get hooked up with this insurance salesperson who's going to sell you what they get compensated for. And they're not going to tell you the truth or what else is available. And so it is imperative that people speak to somebody who is unbiased, who is, I love the fact that we don't charge anything, but
Right.
somebody that, because we're not making anything from this, we want everybody to have all the knowledge that they need so they can make the best decision for themselves. And
So that would be the VICAP counselor for their area agency, right?
Yes, yes, ma'am.
Specific to their region, right?
Yes, ma'am. Yep. And there's
Okay.
counselors in every, yes, we're all over the whole state, the whole country,
Right.
really. But yeah.
I wanted to circle back to Tanya with that Kaiser question. I thought I just want to make sure you got your question answered there. I think Poppy did a great job there of explaining that. That was news to me, so very interesting. And make sure anybody else that had a question that you got your questions answered, or if you have another question, we're just going to leave it open here for another minute, just to see if there are any other questions that come in. I'll tell you, I know Poppy's heard me say this a million times now. I'm getting ready. Getting ready. I'm going to be 65 next year in May, so I know that certainly in January I'm going to make my appointment and start my conversations and try to follow all this great advice. I do feel like, you have to hear this stuff like a lot.
Over and over.
Over and over before it really sinks in. At least I do anyway. So
Oh, yeah.
I'm starting to finally, it's starting to sink in a little bit now, trying to get a better understanding, but it's so great to have these resources. Look, I've been in the aging field for 30, 40 years, and I don't know what to do for Medicare. So it's we
And they
really
make it,
appreciate
it's
the
the federal government. They're going to make it as difficult as possible to understand. There's like laws and all, so yeah. I'm just glad. It's a great service. All of our services are wonderful, but it's a wonderful thing to be able to offer this to help people navigate, because we get calls all the time. They're like, I have a master's in blah and whatever. And I'm like, I know, I swear the smarter you are, the harder it is to understand, because you can't really reason with why is it that way.
That's incredible. Oh my gosh. This is such great information. Again, just to let everybody know that Poppy's slides are up already up on our conference webpage at agingtogether.org. The conference is being recorded. Don't know if doesn't look like anybody jumped on halfway through. So I don't think we lost anybody by starting early, which was good news. But just in case, everything is being recorded and the recordings will be available. So I think we're going to ask you to hang on a minute, Poppy, and spin the virtual wheel for our next raffle winner. So Steve, we got that.
Here we go.
Got the wheel.
Okay, so
There.
Poppy, if you want to raise your hand and spin the wheel, like, is it Vanna White, or who does the Wheel of Fortune?
Vanna White.
Virtually
Okay,
spin.
here we go. So we are spinning the wheel for another. All right, and our next winner is Alexandra Varnon.
All right.
Alexandra Varnon. Okay.
Oh, congratulations. Woohoo.
And we will do one more of those before the end of our conference here.
Alexandra, we will be reaching out to Alexandra to get full address so we can pop that book in the mail to you.
Great.
All right.
And we're ahead of schedule. We've confirmed our next
Yes.
speaker
Sorry.
will be here by 1:30. So I'm gonna set the timer at 10 minutes.
Hey, Steve.
Yep.
Sorry to interrupt.
Okay.
Good point here. Can we remind folks what they've won? Because they're getting that great book from TIPA.
Yeah, here, let me.
Great point
show
there,
you,
Ginny. Thank you, Ginny, for that. Yes.
Where are we at here? Come on. Okay, sorry. I had. There we go. Okay. Now. There, A Heart Full of Gems. It's a book co-written by Teepa Snow. And as we learned, it's a great book for children, but it's a great book for anyone. It's more of a picture book. So.
Yeah, it's awesome. I have them here in my office, and I've been reading through them, and it's really very well done. So Steve, we're going to take about a 10-minute break. Is that right?
Yeah, let's say 10 minutes. And
10
then
minutes?
Amy's going to come on. And our next session is optimizing mind and body. There is Amy. Okay.
That's great. So
So,
we're going to take a little
um,
break and then come back, and I'll tell you all, you don't want to miss this next session. I have heard Amy's presentation